pledge.
Gracious Heavenly Father, we thank you for today, and we thank you for the opportunity to meet in this virtual world today. Father, we just ask that the decisions we make today benefit Putnam County people, our state of Florida, and our country, and our world as a whole. Father, we thank you for the wisdom that we can call upon you and ask for, and you will give it liberally, Father. You'll give it to us when we ask. And Father, we ask today. And Father, we just thank you for our chairman, our board, our staff, and all the people that are working so hard to keep the citizens of Putnam County safe. We ask everything we do. In Christ's name we pray. Amen.
Yeah.
Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America,
to the republic
for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you, Commissioner Harvey, and thank you, Commissioner Pickens, for that this morning. Before we start on public comment this morning, I just wanted to make a short announcement. The reason that Terry and I are out here at EOC is they're going to have another 52 cases dropped today. They had 42 yesterday. So Ken asked us to come in this morning, and when it comes to the next item 3B on the list, she's asked to address the board via this meeting. So she's going to come in at that time and address the board. So I'm going to open up public comment. This portion of the agenda is designed to allow citizens an opportunity to bring matters to the attention of the board. It is not reasonable to expect that the board will engage in debate or deliberation about matters on which the board has received no prior information as part of this agenda. The public is encouraged to watch on YouTube live or by sending an email in advance of the meeting to the BOCC meeting comments at putnam-fl.com. Please include your name, address, and phone number. So, Laura, I believe you have some public comment, do you?
Yes, sir.
Would you read them at this time, please?
Yes, sir. The first one is from William Dollar. He says, please consider an ordinance requiring face mask use in our county. COVID-19 infections are out of control. I am 73 and must shelter in my home in order to protect my health. Let us be part of the solution and not the problem. Thank you, William Dollar. The second one is from Lisa Kane DeVito, 108 South Main Street, Crescent City. Dear Commissioners, 1, please consider using CARES funds, if possible, to hire additional contact tracers in order to more quickly identify those with exposure to the novel coronavirus and allow them to self-isolate and be tested more quickly. 2, please be sure to make CARES Act funds available to Putnam municipalities to assist with the cost of serving the public during the virus emergency. 3, please consider enacting a county-wide mask requirement as soon as possible to prevent further virus spread so that we can return to health and economic prosperity as soon as possible. Thank you, Lisa Kane DeVito. And let me check the email one more time. There's no more public comment at this time.
I received an email from Ms. DeVito, and I'm going to answer it back today concerning items 1 and 2. They're already in motion. The contact tracers are being sent down as fast as we can. We're supposed to have up to possibly 10 of them by Monday that are going to be furnished by the state. So that's in works. And the CARES Act funds for municipalities has been already sent or discussed with the mayor. So I know that she can't speak to the mayor without being in a meeting, but at their next meeting, they should say something, because we've already reached out to, it's my understanding, to the municipalities and told them that part of the CARES fund will be available for them to, on a reimbursement basis, if their expenditure actually meets what is needed. I mean, or what meets the threshold for us to get reimbursed, then they will be reimbursed. So, do you have any more, Laura? Okay. With that, we're going to leave public comment for the moment and move into the CARES Act consultant discussion. And I'm going to let Ms. Young, if she would, take this first. Ms. Young.
Sir, thank you. We have been in a series of webinars hosted by FAC, the Florida Associations of Counties. And the last one we attended was actually the FAC allowing a consultant from Witt O'Brien to make a presentation to the counties about what they have to offer and their services. They are headquartered in Texas and have already been engaged in the nation in a consultant capacity specifically for the CARES Act funding. They propose to lend their expertise typically in 3 distinct areas. 1, to understand the intricacies of the laws, regulations, policies, timelines, requirements, processes, and systems that govern eligibility and reporting to FEMA, HUD, HHS, and other federal agencies. The expertise to identify available options to facilitate your decision-making and maximize funding potentials. And 3, to execute multiple concurrent grant management processes in an accurate and timely manner to realize the funding potential of your county. The consultant sent over a contract for our review. And if you've been with me for any length of time, you've heard me talk about federal funding and what happens in states of emergency. So we're currently in a state of emergency. This is a unique state of emergency because it's not event specific. It is an event. We have a pandemic, we have a virus. But if you think through hurricanes or emergencies you've been through, we know the hurricane's coming to town on or about said date, and we can predict the hurricane's going to leave its destruction and path on or about said date. So typically the federal and the local and the state declarations of emergency have a time certain. In those realms, when you work with procurement, what happens is you get an open blanket for items that mitigate emergency, damage to life, safety, or property. Exigent circumstances, that's what the federal government defines it as. So if you've been with me, you've heard me talk about a cup of coffee. If I've got a hot cup of coffee on a table and I tell you I know it's going to spill in 30 seconds, under federal procurement, you can do nothing until it spills. Go through a standard procurement process. If it spills, then you can immediately go get the paper towels and clean it up. That changes if you have children sitting under that table that you can predict are going to be burned by that coffee. If the children are sitting under that table and you're making arrangements to save their life or to save them from harm, then you get to waive those procurement processes up front. Now, I take you through that to remind you that this is an event that doesn't have a date certain. An event that the consultant is using 2 CFR 200-320F subsection 2, which provides procurement by non-competitive proposals may be used only when the award of the contract is infeasible under small purchase procedures, sealed bids, or competitive proposals. And in the case of client, one of the following circumstances applies. A, public exigency or emergency for the requirement will not permit a delay resulting from the competitive solicitation. So that's the exemption that this consultant is making the case that we can engage them without a formal solicitation. We're in uncharted territory, so I can't tell you with any certainty that will in true hold up to the feds. I can tell you it sounds reasonable given our unique situation of the pandemic, in that we don't know when our start and stop time is. We don't know what a delay in requiring procurement another 60 days would do to our ability to spend these funds and mitigate COVID. So what's for you is the decision as to whether or not you'd like to engage a consultant to assist with creation and maintenance and management of programs, to assist us with writing narratives to support the programs we're gonna launch, and knowing that while they make a good argument, I believe under the federal procurement guidelines, it hasn't necessarily been blessed, and you ultimately end up paying that out of the general fund. With that said, they believe that their period of performance will be not to exceed 180 days from today, and their ceiling price would be $50,000.
Does anybody have any questions of Ms. Young at this time? Commissioner Harvey?
Thank you, Mr. Chairman. I appreciate it. I was going to bring up that same thing that Ms. Young brought up today. That webinar was very informative, and they seemed to know what they were doing. Julianne, I do want to say one thing. I appreciate you. You know, due to the state of emergency we're in, we are able to waive our requirements and sole source this out. And it appears that they are very educated in what they do. It also appears to me that it is an allowable expense under the CARES Act funding due to this. And again, they seem to be the experts in the field right now that we have seen so far. So if their cap, if I'm understanding right, their cap is $50,000 for 180 days of hand-holding, basically advising us on when the board decides to relinquish their plan. They will fine-tune it, they will look over it, and they will help administer. Is that what I'm hearing from you for $50,000?
Yes, so they're a time and fee based scenario, which is allowable under the federal contracts, and they're predicting that for 180 days that their performance shall not exceed a ceiling price of $50,000. So if we were to exceed that, then they would come back to the board and say, hey, this is all we've done for 50 grand, and we predict we're going to need another 20 grand to spend out the rest of your 12.9 million.
Good, thank you. Thank you, Mr. Chairman.
Okay. I got a question. So,
Commissioner Turner, you're muted.
There you go. Thank you. Thank you for bringing that up, Commissioner Harvey. I think it's going to cost more than 50 grand or possibly, and I think we need to cap them out 100 myself. And the reason I say that is because depending on how we end up going with the programs, if we have several smaller programs, then it's going to take more time than if we have just some larger, 3 or 4 larger programs, but we need the help going either way. We're looking into a new program at the moment, and I, of course, can't say anything about it except when we're on this in a meeting that somebody sent us an email about possibly being able to do broadband, you know, in the county under this. We haven't really checked into that yet, but it may be a possibility. And so if that turns out to be the case, it would cost quite a bit. So the next step after this, in my opinion, number one is to get a consultant on board and try to get us going in the right direction. Number two, the board's going to have a meeting, and they're going to have to decide what programs that we want to try to go after, because we have to implement the programs, get the program completed, and get it absolutely approved by, I think it's Department of Treasury, by December 30th. So anything that's not, we've got to pay for. So anyhow, Commissioner Rawls, did you have a comment, sir?
Yeah. So is this the only consulting firm that's available, or wouldn't it be prudent for us to put this out and see if there's any other proposals that people might want to send in?
Yes, sir. And that's exactly why we're meeting here this morning, Commissioner, because it'll, according to Ms. Young, it'll take about 60 days for us to do a procurement. And that'll take 60 days off the time that we'll be able to start these programs. So I'm sure there is someone out there, for absolutely sure. And that's what she was trying to explain to us on the procurement.
I'm not talking about a full-blown procurement, but have we done any research to see if there's any other firms, anybody more local than Texas? You know, have we reached out to the SBDC at UNF or the one in Miami to ask if, I'm sure there's information, the SBDC in Miami that would be able to let us know if there's other consultants out there. Maybe we might have some in our backyard for all we know. But I would think that we slow down a little bit and ask those questions and see who's available, and make a decision from there.
Okay, thank you for your comments. Anyone else have any comments? Commissioner Pickens?
If we were to enter into agreement with this particular firm, would they send somebody to Putnam County, or they're managing from Texas? How would that work?
Ms. Young?
Yes, sir. So we're not, I couldn't tell you entirely, but they do have a team, and they are working with multiple agencies in the state of Florida. And they have a team dedicated to just CARES Act. So we get a project executive, a strategic planning and CARES Act federal assistant servant, a FEMA public assistant servant. So part of their process would also be matching our expenditures or planned expenditures with what FEMA would reimburse, so that we can not lose any pot of money. So they would be able to lend those expertise to go back and forth as far as, to claim this under FEMA first and then claim the 12.5%, or if it's all CARES. Public assistance, cost recovery lead. So they have a team put together as far as where they will geographically be located. I'm sure in light of COVID, most consultants are doing most things virtually because we don't want to transmit anything. But we could certainly ask them how often they would be in Florida or Putnam County.
Okay. And on Jeff's question, how long would it just, how did you actually find this particular one? Was it through the Florida Association of Counties? Is that what I understood? Because you were breaking up when making your presentation.
Oh, I'm sorry. Yes, sir. So the Florida Associations of Counties hosted a webinar where they brought this particular firm to all of the counties to provide a presentation on this particular services that they could offer the counties related to CARES Act. So that is how we became aware of Whit O'Brien's services, a particular consultant.
Okay. Do you have any idea what any of the surrounding counties may have what they're doing or looking at doing as far as hiring a particular firm?
So I know for a fact that 2 counties, this webinar was just Friday, and 2 counties have already executed an agreement with them. And the most she could tell me was that she's providing multiple agreements to other Florida counties, but she couldn't tell me those particular names.
Okay. All right. Thank you.
Mr. Harvey?
Thank you, Mr. Chairman. I would like to point out that this is a partnership with the Florida Association of Counties, just like the trust is, and just like some of the other programs that the association enters into. So this is one of the partners of the Association of Counties. So I'm sure that we're getting some sort of a break on price, I would almost imagine. Commissioner Rawls, I had that listed as going out for bid. But truly, when I watched the webinar last week,
Right.
I clearly saw that they were large and in charge of the knowledge that they had. Commissioner Turner, you're almost correctly. I did send you all, I sent Mr. Suggs a link yesterday from the Department of Emergency Management on questions that are being asked. Again, this is being done by the state of Florida, not the Treasury Department, and they are going to be monitoring our spending on this. But I tell you, Allison up there has a good handle on all the things that we are supposed to do and can do. And clearly it looks like to me that Whit O'Brien, if we go in that direction, can contact them through the Florida Department of Emergency Management, ask any questions, say what our plans are, and start downloading some of that other money that we need. So yes, the Treasury is still the big elephant in the room, but as we get down to the state level and our funding, it's going to be coming from emergency management. So I support the fact that we go to Whit O'Brien immediately. I think if we wait 60 days, I think we're going to miss an opportunity to help those people that clearly need help. And Chairman Turner, before I let it go, I agree that we need to have a meeting sooner than later. I've submitted some of my plans to the administrator already, submitted what I'd like to see done in prioritized order, submitted some contracts that I see that I plagiarized off of other counties in Florida. So I think that we need to move very, very fast and not wait 60 days, because I don't think our businesses can wait and our citizens can wait much longer for the needed help that we can do for them. So thank you, Mr. Chairman.
Thank you, Commissioner Harvey. And I totally agree. And that's why I called this special meeting this morning, is because I feel strongly that we can't get there without a consultant. And I think because of Whit O'Brien partnering up with Florida Association of Counties, that gave them some credibility in my book for sure. Yeah. So that's why I asked Ms. Young to reach out to them and get the information that she got, and where we could bring it to the board this morning for this. I'd also like to take her recommendation and place a cap on it. I'm not really sure, and maybe she could let me know. Yesterday afternoon when I was talking to her about this, we were talking 100 to 150, and now we got down to 50. How did you get from 150 down to 50 overnight, Julianne?
Cheap, remember, that's what I'm here for. No, sir. Whit O'Brien's best estimate over the next 180 days is that realistically we're going to be around 50, and they suggested actually the 50 cap. So I have been in communication with them night and day in order to put this information together for you, and that was their suggestion. And then of course we could always come back to you all if we're going to exceed that by any amount of money.
Okay, thank you. I think that's an excellent suggestion. So you're suggesting this morning we cap it at 50 and come back to the board if there's any additional funds needed. And
yes, sir.
And or if we end up at somewhere along the trail, we're going to find out that it's actually going to come out of our pocket instead of the CARES Act if they're not in, if a rule comes down, correct?
Yes, sir.
Okay. Well, I still think we need to do this because I don't see an avenue for Putnam County with its current workload and its current staffing that they have the ability to put together multiple programs and get them done. And so, you know, in my opinion, I do think we need to move forward with this. And yes, Commissioner Pickens.
Yeah, Mr. Chairman, I agree with that. Is, you know, do we have anybody on staff that has that expertise? And we're short staffed anyway. So I agree that we need to bring somebody on board, you know, to help us administrate this. So I agree with you 100%.
Okay. The chair will entertain a motion then.
Mr. Chairman, this is Commissioner Harvey. I move to pass the $50,000 cap with Whit O'Brien and hire them as our consultant for the CARES Act money.
I'll second.
I have a motion by Commissioner Harvey and a second by Commissioner Goddard that we proceed placing a cap of $50,000 on Whit O'Brien. Under discussion, Commissioner Rawls.
I don't know that I'm comfortable on past this today. I think we should have something that we can look at. We've had a discussion about it. Maybe bring this back next Tuesday at a regular meeting after we can take a look at what's actually being proposed in the deliverables. Part of the concern, and it's not a major concern, is that we're hearing this from a lobbying group, number one, albeit the Florida Association of Counties. I don't know what, if any of their intention is to push the money into the public sector as far as businesses and citizens. You know, there's been no presentation made to this commissioner. I've not seen anything in writing. I'd love to see something from them as far as what we can expect for the $50,000 or more dollars, because this could be $150,000 right off the bat. So, you know, I'd like to see us slow this thing down for at least till next Tuesday, so I can take a look at what we're getting for our money and see which direction they're heading in.
So,
Commissioner Harvey.
Thank you, Mr. Chairman. Commissioner Rawls, I appreciate those comments. They're going to follow our plan. They're going to do what we tell them to do. We're going to set a bunch of things that we like to see done in our community, and they're going to test it against the Treasury and the state rules to see if it works. That's my understanding, and the webinar clearly said that last week. They're kind of our inspector general, if you will. They're going to lead us through what we want to do, not what they want to do. So, and that's why I don't think we have a meeting next week, but I heard the chairman say that we need to meet very soon on the fact of what do we want to do. I've already
14th,
submitted my
14th.
plan. And the 14th is not next week though.
Yeah.
It's so, but I've already submitted what I like to see in the prioritized order, and I'm sure y'all have too. So I think we just need to move. We got a good company, a good partnership. They are our association. We are partnering with them. I think it's a win-win situation for this county and for us at the same time. Thank you, Mr. Chairman.
Thank you, Mr. Harvey. And I don't disagree with that statement at all. I'm not saying that we go out tomorrow and put together all this, but I think at the webinar that the ones of us that could attended, basically said, get your money on the way, sign your funding agreement, which I did that day, and then take a breath. Well, I think we need to take a breath with a consultant, because whatever programs we come up with and get approved, and somebody that's going to write the directive on them, or we need help with that. And so that's what we need to do to move forward once we get the plans in place of how we're going to spend this money, because there's multiple plans, multiple ways we could spend it, and the commission is going to have to vote on how it goes. And we need a consultant in place to take it from there. Is there any more discussion before I call for a vote? Commissioner Pickens?
No, I'm good. I'm good.
Okay, Commissioner Rawls?
I agree with everything you're saying. I just think we're taking this a little bit quickly. So I'm not in a position to vote yes for this right now, but I understand y'all want to move it forward, and I respect your desires.
Okay. I'm going to do a roll call vote at this time. District 1?
Yes.
District 2?
No.
District 3, yes. District 4?
Yes.
District 5?
Yes.
Okay, did you get those, Laura? Or I guess Sarah?
Yes, I did.
Okay, thank you. Moving on, I would like to do a 3-minute recess while we go find Kenna. She was wanting to address the board before we get on the next item, which is basically future meetings and how we're going to handle them from here on out. So 3-minute recess. to invite Kenna Foster, county's head nurse and epidemiologist for the health department here in town, and she and asked her to address the board. Ms. Foster, thank you for coming this morning.
Thank you, Chairman Turner and Administrator Suggs and Commissioners, for allowing me to address you today. I wanted to give you an update on Putnam County and COVID-19. Today, we will currently be at 433 cases in Putnam County. We will report 52 cases today. We reported 42 yesterday, so that is 94 in the past 2 days. Our percent of positivity yesterday was 16.3%. You always aim to be below 5% so that you don't have widespread in the community. The results of the increase in testing in cases is not from mass testing. These are actually cases that have been found through contact tracing or individuals that have presented to their physicians, urgent care, called the hotline, or to the ER with symptoms. Due to the demand in testing, the beginning of last week, we had the ability to test roughly 64 a day. We made the decision Friday we needed to double that ability because of the demand. We increased it to 128 a day that we could do at our community test site. Tuesday, we were already scheduled out for a week with symptomatic individuals or direct contacts. So we have increased the scheduling capability yet again to serve 360 residents who seek testing needs. The EOC operates at 7 days per week, 8 to 6. Contact tracing will continue over the holiday weekend. Yesterday at the EOC, we had 504 inbound calls. Those were citizens that were saying they needed testing because they were direct contacts or they had symptoms. These are not the general question calls that we were receiving before. Our cases throughout Putnam County include clusters, outbreaks, and widespread activity. The increase in cases has affected several businesses. Some businesses have had to close for several days or alter their operations due to loss of staff. Please note this was not the recommendation of the health department that they close. When we have a case that tests positive and we contact the employer to see what employees or patrons could have been exposed, we review cleaning procedures with them. We review tips and infection control practices, but we do not make the recommendation of closure. Closure was made at the owner's discretion in these cases. Hospitalizations for COVID in Putnam County are up. Our ER visits are up with COVID, and so are our ICU, with the majority of our ICU with COVID being under the age of 55. We continue with epidemiology on call 24/7, and I'm averaging 7 to 10 calls a night. Additionally, the health officer receives calls from community members. So under FDOH and Mary Garcia, the health officer, my role as epidemiologist is to identify cases, prevent spread, and assist in getting our community back to a healthy prosperity state. So it is not to say we need to close and stay home. And I just like to start with that before I give recommendations. I think we can all sit back, regardless of what our personal opinions are about the virus or masks or hand washing or isolation, and say, at this time, we have increased cases. And I, as the epidemiologist, are telling you, it is not because we are doing community testing. It is because your citizens are sick or have been in direct contact with cases. So the recommendations we make are merely that, recommendations that I have discussed with the health officer, that I have discussed and read recommendations in peer counties. And so the recommendations are that all employers screen employees before they present to work or when they are presenting to work. And employees should step back before they leave the house and say, do I have any of these symptoms of COVID? And if they do, then they should contact their supervisor and then call the hotline so we can schedule them for a test and a triage. Please remember why this is important also is why we're seeing businesses affected. It's not because we are saying close. It's not because we're in phase 2 or phase 3 or phase 1. You are contagious 2 days before you ever show a symptom. So you can go to work. I'm just going to use a bank as an example. You can go to work and work with your 30 peers and 150 patrons and feel absolutely fine and look absolutely fine. You go home that night and you become ill. That means 2 days before you ever became ill that night, you have exposed anyone that was within 6 feet of you for 15 minutes. So that is why we are seeing the spread and the operational changes in the businesses, because they have so many individuals. I had one entity, it started off with 1, and by the end of the week they had 7 that were positive, and they were symptomatic. So they had no choice but to alter their operations, close for a couple of days, clean, work on some new procedures. But I'm happy to say, with them working hand in hand every day with the health department, their outbreak stopped within 2 weeks. And they've resumed normal business now. So that was a success with that. We recommend that all public meetings be conducted via Zoom through August 1st, 2020. Recommend that public offices with the county have appointment only and closed to walk-ins to protect not only the patrons, but the employees through August 1st, 2020. We continue as commissioners, employers, to communicate to our citizens phase 2 guidelines: social distancing, stay home if you're sick, wear a mask in public, gatherings of less than 50. I'm asking the commissioners, we have been tasked by the state surgeon general, if we are aware of an advertised event that does not meet phase 2 guidelines, meaning it will be greater than 50, we are to work with the business to educate them on the phase 2 guidelines. If they still choose to continue with the event, then the health officer will reach out to the surgeon general. It is not always to say you have to stop the event, because in the end, the health department does not say you cannot have this event. But if they choose to continue, we need to make sure they have safety measures in place at least, which could be taking them masks. It could be educating them on hand washing stations, those types of things. So that's our role as FDOH. Frequent hand washing, and those are the basic recommendations. I understand that we have been at this since March, some of us since January. It's been 6 months for me, been 6 months for the health officer. I would like, from the bottom of my heart, to thank each commissioner that has provided the support to FDOH and the EOC team, for all those that have volunteered to contact trace, that have worked until midnight down here. It is remarkable how we have come together as a community, that this is not over. This is increasing. We are going into 4th of July weekend. We can expect to see a continue of increase of numbers, especially in 2 weeks after the 4th of July. We're working closely with the school district to ensure when summer school starts on Monday that it can be done as safely as possible. I've been working with Dr. Swarency with that, and we'll do so if the board votes to open on August the 10th with school. So I want to reiterate again, our goal as FDOH is not to say we do not need to open. We all know we need to get back to where we're healthy and we can prosper as a community, but we need to take the steps we have to take to get there. So as epidemiologist, and speaking on behalf of Mary Garcia, the health officer also, and incident commander, I would welcome any commissioner to come down to the EOC to assist with contact tracing or just observe the process and ask questions. It is different when you can see how we're drawing things on the wall and how this case links to this case. And it always helps to have an extra set of eyes, extra suggestion. We've been pushing the same message since March. Numbers are going up, so we're looking for ideas to change things. So thank you for allowing me to speak, and I guess I'm open for questions.
Do we have any questions this morning for Kenna? Yes, Commissioner Harvey.
Kenna, thank you very much for your dedication, and Mary, to the amount of work that's being done. I appreciate the invite to come down, but I have asthma and I don't know where y'all have been. So I'm trying my best to stay away from any type of huge event. When you can't breathe to begin with, it's kind of hard to do something. I tried to write these down, Kenna, as fast as I could, but when you got to number 6, events over 50, and then you said wearing masks in public. I think you kind of merged all 3 of these things together, but I didn't catch it. Number 7 was hand washing.
Right.
Can you go back over that? Because I am not in favor of a mandatory mask for Putnam County, but can you go over it? Are these just recommendations? Are we voting on this, or what's fixing to take place here?
Well, if I could answer that for you, Commissioner Harvey, I felt like that this board, because I had called this special meeting on the consultant, this board needed to hear this from her. And I need direction on how I took upon myself to have a virtual meeting this morning at the recommendation and urging of the health department. They are recommending and urging that we continue to have these type of meetings until August 1st, now that the governor has extended the state of emergency, where the last time we spoke about this, the emergency got over on July the 7th. So he has extended that till August 1st, and that gives us the opportunity to do this, and that is a recommendation and the urging of the Department of Health. And so, like I said, I took it upon myself this morning to call this meeting virtual, and put it on the agenda that does this board want to continue having virtual meetings through August 1st at the recommendation of the health department, or do we want to go back to having live meetings? And I don't want to, I'd refuse to make that call myself.
Well, Mr. Chairman, while I still have the floor, I'm in favor of Zoom meetings. I met with Bob Stender, and over, I think it was Tuesday, Bob and I had a chance to sit down for well over an hour. And my concern was always being transparent and open to the public. But truly, and Bob kind of showed me the light, if you will, that we're probably more transparent to the public and more accountable doing Zoom meetings instead of risking our citizens' health coming into an office, and actually by social distancing, limiting how many people can be there. But I want to go back to my question, Kenna, because I think that's where I was at. Are these just, if we adopt all the recommendations, you said wearing masks in public.
Okay,
so I would like to.
Please finish. Sorry.
I think he was finished.
So Commissioner Harvey, let me clarify. These are the recommendations the Florida Department of Health, and we've seen since the beginning. This is not me saying that the county should adopt a policy that all citizens must wear a mask when in a business or outside. This is just me as a health professional communicating to citizens that you are safer when you wear a mask. That is your choice as a individual. But just like washing your hands, social distancing, being 6 feet away, wearing a mask is a health intervention that can prevent transmission of COVID. So by the way, was I saying the county should adopt all mask policy.
And please keep in mind, Commissioner, if I may, the only thing that I'm asking for direction on today, most of this was for our information. The only thing that I'm asking direction on today is, do we continue having virtual meetings through August 1st? And what do we do with the county offices? Last time I shut them down as chairman, but we reopened them together. And I'm not gonna close them back down without doing it together also because of the way this has transpired. Commissioner Harvey?
Yes, Mr. Chairman, thank you. And I agree with that. I think I said it earlier, I believe the Zoom meetings give access to our citizens a lot better. We were all hoping numbers were going down. And I thank God that I called the July 4th thing off for the town of Interlaken because it would have been too much. We couldn't have handled it. So to answer your question, this commissioner is in favor of Zoom meetings. This commissioner is in favor of shutting down our offices until we have appointments only. And I think that only protects, if we had a massive breakout in our office, we would have a lot of people. We're already short-staffed, as Commissioner Pickens said, but we have very important people that are working right now on very important items. And we've got to take very much precaution. It's only 30 more days. You know, maybe we can get a handle on this and be back open. But this commissioner thinks we should Zoom meet until August and maybe later if the governor allows, and we should have our offices shut only to appointments only.
Is that
Thank
a
you,
motion, Commissioner Harvey?
Thank you.
Is that a motion, Commissioner Harvey?
I think there's other
Could be.
people want to talk, but I'll be glad.
We can discuss it under discussion.
I'll make the motion that we have Zoom meetings until the governor decides not to, and that we should shut our offices down to appointments only and lock the doors.
I'll second that.
We have a motion by Commissioner Harvey and a second by Commissioner Goddard. Under discussion, Commissioner Pickens.
Commissioner Rawls was first.
I'm sorry, I missed it. Commissioner Rawls, my apologies.
I think we're getting a little too quick on the trigger here. Number one, I think we're disparate in the way we treat our employees by allowing some to stay home and not have to work, and then telling others that they have to work. I think we should all continue to come to work until we either symptomatic or test positive for COVID. If we're not going to shut the county down and ask other employers to do it, why should we be doing that as well? It's, you know, we're going to ask quote unquote necessary employees to take risk, but not everybody. So I'm opposed to shutting the offices down. I think it's counterproductive. We've got a lot of work that we've not been able to do. We need to continue moving forward. We have a budget that we've got to get put in place. So I don't, you know, meeting virtually is fine. I prefer to meet in person, but I understand virtual meetings are effective as well. So on that part, I could vote yes, but I can't vote yes on the part about closing the offices back down.
Okay. Thank you, Commissioner Rawls. Commissioner Pickens.
Yeah, I agree with that we should go back to the virtual meetings. I really hate that we can't meet. It's just not the same as meeting in person. And but anyway, with the reclosing of our offices, Administrator Suggs, would you go back, and you may have been continuing to do this? Will some work, 1 week at the offices and then work at home? I didn't know that there were people actually not working when they were at home. I thought that when they were home, they were still doing their jobs. Will it be the same process as last time?
Commissioner Pickens, Mr. Chairman, all staff are back at the office working, and they had been prior to us opening back up. We had brought everybody back in. So every department is fulfilled, and they're doing their job, and I don't know what processes aren't getting done. Still doing permitting every day. We're still doing building inspections every day. We're still mowing grass every day. So those concerns I'm not able to address as far as that, but I will tell you that staff is back to work and has been back to work, and we're doing things that we need to do to be socially distanced, as well as following the CDC guidelines. And while I got a comment I'm going to make, Mr. Chairman, after this conversation about a request from the court system.
Okay, but if we do vote to close the offices, will you go back to? I think some were working from home, and then the next week they would work at the offices. Would you go back to that scenario?
At this point, Commissioner, no, sir. I think by limiting the access to appointments only, that are safer, in a better position being back to work, and we're able to do the things that need to be done to continue the process of getting the job done as required and being able to service the citizens throughout this pandemic.
Okay. All right. Thank you.
Okay. Is there any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed?
Aye.
Let it for the record that Commissioner Rawls opposed the motion and passed 4-1. You got that, Sarah?
Yes, I do.
Okay, thank you. With that being passed, I want to bring one other part of a little small business to the board. The Rotary Club of Palatka has reached out to me and asked could they install a flagpole at the corner of 17 and 19 at Triangle Park. They're going to furnish the flagpole and do the installation. So I had no reason to deny it whatsoever, but I felt like I'd just bring it to the board this morning because they only asked a day ago or so.
Mm-hmm.
Looks to me while waiting that unanimously we're going to thank you very much, and you bet.
Commissioner Turner.
Yes, sir, Commissioner Rawls.
Just point of technicality, that's a Port Authority issue.
Sir?
I said it's just a technicality, that's actually a Port Authority issue.
Correct.
Yeah, I agree with you 100%, but the Port Authority is us too. If anybody has a problem or wants to take it to the port, we'll certainly do that at your request, but it's just a flagpole that's being built.
I agree. I agree. I'm just saying,
okay, no, sir, I agree with you 100%, but
I have no problem with that. I'm fully in favor of it. I think we should have flagpoles at all of our buildings, including our fire and EMS buildings as well. And we had that the other day, and I think we should have them all everywhere.
Mr. Pickens?
Yeah, Commissioner Turner, will the flag fly, 24/7, or will somebody raise it and lower it every day?
I can't answer that, Commissioner Pickens. All I can say is that they're willing to give us a flagpole, and that we're working on getting flagpoles at all of the fire stations.
Okay, so they're just going to donate the pole. Okay, I'm with you.
They're going to donate the pole. What we choose to do with it's probably going to be up to us.
Okay.
You done, sir?
Yep.
Okay, Commissioner Rawls.
If the poles are lighted, the flag should say 24/7. So maybe we could, I know there's power out there at Project Play. Maybe we can help out by putting a light, a ground light, or maybe a solar light. I've seen some flagpoles lately going up that have the round solar discs on top that are self-illuminating.
Right, I would agree. That's what I was going to get at. But if they're just going to donate the pole, great, and we'll worry about it in a Port Authority meeting about what to do as far as the flag itself and lighting. Okay, thank you.
And as county administrator, I will assure you we'll follow all guidelines, federal and state guidelines on how we are to light it and monitor it and maintain it.
Okay, so thank you for that, Commissioner. We'll get back in touch with the Rotary Club and give them our thanks.
Yep.
Also, let's see, I think that's about it. You had something
Yes,
else?
sir.
Under the county administrator comments.
I've been contacted by the court system, the clerk of the court's office, as well as Judge Boatwright, about the opportunity of using the BOCC chambers as a jury pool selection room. They're not sure if they're going to use that room or not, but they're just seeking a conversation on whether or not that might be an option for them in the future. I talked to Judge Boatwright yesterday. He said it would be 2 Mondays a month, up to about 50 people per visit, but they are looking at other options as well, other venues as well. But it was just a conversation we had yesterday. I told him I would mention it to my 5 elected officials and get some feedback going, some discussion going. However, it seems that we're shutting down through August. It certainly wouldn't start till then. But it's just one of those things that I think we need to work in conjunction with our partners and help them out as best we can. So by way of conversation this morning, or call me later, and so we can discuss it, I'd be more than happy to talk to you, take your opinions, and get back with Judge Boatwright and with the clerk's office.
I don't have a problem with it.
Yeah.
Commissioner Harvey, you're muted, but you're okay. All right. Commissioner Pickens,
okay.
you're okay with it. Commissioner Goddard, okay. Well, I recommend that we just turn that decision over to the county administrator to work with them as he sees fit.
Because we're going to have to put in some protocols as well, such as the temperature readings, the CDC guidelines, the cleaning of it, and all that. So there's going to be a process we'll go through, but I just wanted to give the judge an opportunity for some feedback today. So thank you.
Okay, thank you, County Administrator Suggs. County Attorney Rich Commando. Rich, do you have anything for us today, sir?
No, Mr. Chair. Thank you for asking.
Okay, thank you very much. And we'll start with Commissioner comments. If we have any today, Commissioner Rawls.
I have none.
Commissioner Goddard.
I do have. I am so thankful that they have started on what do you call it? Kelly Smith School Road, actually milling it today. And I'm glad I went out there. That road, it gets a lot of traffic and it needs some tender loving care on it. But it was just good to see us getting started on that road. And I want to thank everybody that helped get that going.
Thank you, Commissioner Goddard. Commissioner Pickens.
Well, I may have all the equipment in District 1, but from what I understood, we were supposed to start on 308 before Kelly Smith, but Julianne assured me they're going to start July 6th, so I'm looking forward to that. But at least they're getting started on some of these resurfacing projects. Ken, I just want to say thank you to you and your staff and Health Department, Mary Garcia, the whole EOC, all the volunteers, the workers, for everything that y'all are doing out there. I know it's a tireless effort. I will get with you later this week. I would like to volunteer one day next week to do some contact tracing. So hopefully I'll be able to do that for you. The mask, I've had a number of emails about if we're going to discuss a mandatory mask ordinance for Putnam County. And I assured the people that if we were even going to consider it, that we would have an agenda item and that would be advertised at least 24 hours ahead of time. So that's how that would work, correct?
That is correct, sir.
Okay. All right. I just want to say, because I've had some input both ways, just as the emails today. So I just told them that we definitely weren't going to vote on it today, and I did not see it on the agenda for the 14th. So, but there will be a lot of input, I believe, if we just start to discuss that. So, and I think, as Kenneth said, just continue to, encourage the practices from hand sanitation to your mask, the social distancing, those type things. I think that is probably appropriate. So I think that's all I have.
Thank you, Commissioner Pickens. Commissioner Harvey.
Thank you, Mr. Chairman. I appreciate the opportunity. I do want to thank all the staff, Kenna and Mary and everybody involved. And if I can do anything from my location, I can do it all day if you need me to do something. I just don't want to come down there and do it. So if there's something I can do here, just give me a holler. I've got a cell phone, a county cell phone. I'll be glad to make calls. Do want to look forward to the 14th meeting and appreciate Commissioner Pickens, you bringing that topic up. I would like to say, Commissioner Turner, Mr. Chairman, you mentioned that maybe we need to have a meeting pretty soon about the CARES Act money. Are you anticipating before the 14th, or are you looking at sometime next week or after the 14th?
Commissioner Harvey, as soon as Ms. Young and Whit O'Brien or whoever we're going to use gives me some kind of clarity that they're ready for us to meet and come up with programs for them to pursue at whatever point that is, I am going to call a special meeting, because I feel like it is very important that we get that process moving. But today, I don't know if that clarity is going to come on Tuesday or if it's going to come the following Tuesday. And right now we'd be meeting for no reason whatsoever because we're not even sure what's going on. So my suggestion would be to get this consultant on board, let Ms. Young, who I think is heading up the team for us on this, and get them talking and coming up with ideas of the way they'd like for us to move them forward. And then we'll call a meeting. If that's all right, sir.
Yeah, that's quite all right, Mr. Chairman. I appreciate that. I did not know Julie Young was handling or heading it up. But Julianne, I will start sending my proposals to you. I'm sure Mr. Suggs have already forwarded those to you. And I would encourage the rest of the commissioners to do that. Thank you, Mr. Chairman, and a great meeting today, sir.
All right, there's one last thing that I'd like to bring up, and nobody on this call knows that I was going to say this, but I think it's important. At some point in this process, we are not going to have the employees to do this CARES process. I don't know how many employees it's going to take. I don't know to administer these programs, but as I would like to ask Ms. Young as she goes through this, that if she could give us a recommendation on what she needs. She can't do this by herself, and it's unfair of us to ask her to do that, even with a consultant backing her up some. So as long as they all determine that those people can be paid for by CARES Act money, we just need to decide that's going to be part of it. We can't expect one employee or even one employee with a backup of a couple more to be able to put on a $13 million program. So, you know, I just want to let everybody know, and that's my comment that I wanted to make today, was that it's coming, guys, and we're probably going to have to, in order to get it done, we're probably going to have to increase the authority of the county by so many positions, even if they're temporary during CARES Act, that's going to be dedicated to CARES Act, because right now they don't have the authority to go hire a bunch of people. Or even any people specifically for this. So I'm going to ask Ms. Young to get with Administrator Suggs and try to give us a number of what they need to make this work, if we could, or maybe get it ramped up. So, and report back to us. Thank you, Ms. Young. I see you nodding your head and still smiling, so that's a good thing. All right. So, is there anything else to come before the board today? All right. Hearing none, I'll recess this meeting at this time. Excuse me, adjourn this meeting.
Okay.
Have a good week.
My